Live. Good morning, good morning. Yes, thank you for joining us on another Thursday. We are live in the D with Mr.BB, and we hope you enjoy your Thursday this morning. In studio with us today, we have none other than Dr. Wanda Shurney of the Sickle Cell Disease Association, Michigan chapter, and she's here to talk about a couple events they're having, upcoming events. Give us a little bit of insight on sickle cell and whatever else she wants to talk about this morning. So we've got Dr. Wanda Shurney again of the Sickle Cell Disease Association, Michigan chapter, coming in to talk to us this morning, right here on Live in the D with Mr.BB. We'll be right back.
SOS Graphic Design provides agency-quality professional graphic design services from established companies to startups and individuals, creating a simple logo to complete rebranding and delivering visual communication with print media. Everything SOS Graphic Design does has a single unifying objective: to set your business apart. We are at your service. Call 313-342-2166. That's 313-342-2166, or online at www.sosgraphicdesigns.com.
It's live
Live
in the D with
BB.
BB.
It's Live in the D with Mr.BB every Thursday at 9 a.m. right here on WVI 107.3 Radio We Can See.
That's why I had to say, come follow me, come follow me. That's why I had to say, come follow me, come follow me. That's why I had to say, come follow me now, right now.
We are back once again. You are live in the D with Mr.BB, and we are joined this morning with Dr. Wanda Shurney of the Sickle Cell Disease Association of America. Good morning, Dr. Shurney.
Good morning, Mr. BB.
Good morning, good morning. So, we want to jump right in. We understand that, of course, you are with the Sickle Cell Disease Association, so tell us a little bit about that.
Well, the Sickle Cell Disease Association of America Michigan chapter was founded by my father, Dr. Charles Whitten.
Okay.
And we have a number of important missions. The first is that we want to help to improve the quality of lives of individuals living with sickle cell disease. And Mr. BB, there is so many exciting things are going on in the sickle cell community now. Lots of drug companies are interested in doing clinical trials in the sickle cell space. And I just attended a conference called Accelerate the Cure. And scientists really feel like we're going to have a genetic cure for sickle cell disease sometime in the next 5 years.
Oh, wow.
So our concern is, well, what are we doing in the here and now to improve the quality of lives of individuals living with sickle cell disease? So that's one of the main focal points of our organization. Another mission is to make sure that people who have sickle cell trait know that it's possible for them to have a child with sickle cell disease. So it's very important for people to know their sickle cell trait status. And in addition to that, we want to just promote awareness about sickle cell disease, and so you're really helping us to do that today. The Sickle Cell Disease Association of America Michigan chapter serves as the coordinating center for the newborn screening program for the Michigan Department of Health and Human Services. So every baby is tested at birth for sickle cell disease, and we're responsible for sharing that information with the parents.
Good. Okay, so before I get into my next question, you said just a moment ago, not only does the Federal Drug and Food Administration think that we can have
a cure,
a genetic
cure
in the next 5
for
years,
sickle cell disease.
which that's
Absolutely.
the first I'm hearing of it.
Okay.
But things we're doing now, so how's the Sickle Cell Disease Association and Michigan chapter, what are we doing? What are some of the things we're doing now with the testing?
In terms of the cure, or just in terms of testing?
In terms of testing and keeping the patients healthy.
Yeah, okay. Well, one of the things, I'm involved with 2 federal grants. And, there are a lot of challenges that the sickle cell community faces. And one of them is that we don't have enough doctors that know how to and are willing to take care of patients with sickle cell disease. So one of the things that we're doing is educating physicians. We're traveling all around the state, educating physicians on what is primary care, what does primary care for individuals with sickle cell disease look like, okay? Then in addition to that, we have developed a patient empowerment toolkit. And what that is, it has a bunch of things in it that would be helpful to an individual living with sickle cell disease. So, of course, you know hydration is so important.
Right.
So there's a water bottle. The medications that you take are important. So there's a pill dispenser. Infection is a leading cause of death in sickle cell disease. So there's a thermometer. When you're going to the emergency room, frequently it's cold, and you know changes in temperature are bad for individuals with sickle cell disease. So there's a blanket. But Mr.BB, the most important thing in that toolkit is something called a passport to health.
Okay.
And we have community health workers who are working to help individuals fill out their passport to health so they know what type of sickle cell disease do they have, what medications are they on, what doses. So they're not going to the doctor and saying, I take this little blue pill. You know, they know exactly what medications they're on and why they're on them. They know all of their surgical history. They know their usual hemoglobin. And that way they are really empowered to be involved in patient-centered care. So I think that's a really important step we're taking in terms of, and another thing that's in there is different ways to manage stress. You know, aromatherapy, a massage, you know, talking to a mental health professional, so that, because we think that stress can really trigger that sickle cell crisis that everybody is.
That personally,
okay.
I think, myself. So how can we find out more about the Sickle Cell Disease Association as a whole, but specifically the Michigan chapter?
Well, we have a website, and it's scdaami.org, and we have lots of information about the work we do, about sickle cell disease, and about the events that are coming up.
Right. Can you give us some insight on the different types of anemia and the importance of getting tested?
Okay, the different types of sickle cell disease are really important to the patient. You know, the most common type is when both parents have sickle cell trait, and the child gets a sickle gene from the mother and a sickle gene from the father. That's called SS, or sickle cell anemia. Now, there's another trait that a lot of people aren't even aware of. It's called hemoglobin C trait. And if you get a C gene from one parent and a sickle gene from the other parent, then you have the SC type of sickle cell disease. And then there's a condition called thalassemia. And if you get a thalassemia gene from one parent and a sickle gene from the other parent, then you have sickle thalassemia. And frequently, the first question the doctor asks you when you go to, you know, if you're in the emergency room or wherever, is what type of sickle cell disease do you have?
Right.
So it's really important for you to know so that the physician can view you as an informed patient. But the difference is in the genes. We basically take care of all the different types of sickle cell disease in the same way, but the difference is what genes you got from your parents.
Now, I know with my sickle cell, I have sickle cell anemia, SS, right? And with that, I know there's two levels to it. I experience the pain, and the other part is some patients experience more so mental issues, and strokes and things of that nature. So with that, do all sickle cell traits and whatnot, the different kinds have their own side effects, and do all of them cause pain or whatnot?
That's a really good question. And, you know, the first part of my answer is that every patient with sickle cell disease is different. Okay, so it's like there's a broad spectrum. There's some people with SS disease that do extremely well, and there are some patients with SS disease that have a lot of trouble. Okay, so but the major difference when you talk about, and it's important that you bring up what we call central nervous system complications of sickle cell disease, because those are some of the scariest complications. You think about your brain being affected, right? And so sickle cell disease is a disease of blocked blood vessels. If you have a blocked blood vessel in your brain, that's a stroke. You know, we know that can leave you with, it can actually be very devastating. So it's basically people with SS disease during early ages, like the peak is probably between 5 and 12 when people with SS disease can have a stroke. But Dr. Bob Adams did a special study called the STOP trial, and it showed that a special kind of ultrasound can predict which patients are at higher risk for having stroke. And then if we put them on transfusions every month, so we call that a chronic transfusion program, we can actually prevent people from having strokes who have sickle cell disease.
Really? That is amazing.
Yeah.
So how can, with all we just discussed and all we're going to discuss, how can we go and how do we go about going to get tested for sickle cell? I know you said that all babies are tested at birth.
Right.
But what if someone, like, I know my parents, that's how, they got me.
I think I
believe
called your mother.
Right. My father did not know until
he
they
had the
actually
trait.
had me that he had the trait.
Yeah.
So
And
for
that,
those of us who are
yeah.
in like their 30s or 40s already, how can we go get tested?
So this is a really common occurrence, what happened with your situation. In the Detroit metropolitan area, when we get the newborn screening result, I'm the person that calls the mother to tell her that the baby has sickle cell disease.
Okay.
And frequently, she will say to me, that's not possible. I know I have sickle cell trait, but the baby's father doesn't have sickle cell trait. And then what that really means is that she asked him, do you have sickle cell trait? And he said no.
Right.
He didn't say, what is that? Or I don't know. He said, no, I definitively don't have that. And so then what happened is he can come to the SCGAA, and just from a little finger poke, we can determine whether he has sickle cell trait or not, and frequently he does. So when you talk about testing, usually an individual with sickle cell disease, we have newborn screening now, but it started in Michigan in 1987.
Okay.
But usually, if you have the actual disease, you're going to have some symptoms. Even if you were born before 1987, or if you immigrated from some place where we don't have newborn screening, you're going to have been to a doctor and saying, hey, I'm having pain, or, my eyes are yellow, or I'm tired all the time, and somebody will diagnose sickle cell disease. The testing is important to detect the carrier status or the trait status. So what we want people to do is come and get tested for sickle cell trait. And the main reason to get tested for sickle cell trait is that we want to make sure you know that whether or not you're at risk for having a baby with sickle cell disease, because we don't want you to have a baby with sickle cell disease by accident, only by choice, knowing the challenges that you will face in raising a child with a chronic illness.
Absolutely. That's a challenge future Mr.BB and his future babies will have to challenge. But that's something to cross. That's the bridge to cross when we come to
so
it.
I am sure you will be bringing your wife to me to be tested for sickle cell trait.
Absolutely. Okay, but one of the other main reasons we got you on today is to talk about some of the things that your association is doing with bringing awareness to the community and bringing the community together as a whole to support patients with sickle cell. So what I know we want to jump into now is I hear there's a walk coming up.
Yes.
A 5K walk.
Yeah.
So can you give us some information about that?
I can give you some information about that. Every year for the past 5 years, we've had a walk. And one of the things that I've noticed is that most of the people at the walk have sickle cell disease, or their family member has sickle cell disease, or they're a friend of somebody with sickle cell disease. So it hasn't raised much awareness, because everybody there is already aware of sickle cell disease. So, but the other thing about our walks is they tend to be more of a ceremonial walk, because it is maybe a mile, And we talked about the anemia in sickle cell disease, so sometimes people with sickle cell disease get tired easily. So a 5K is not really something that some individuals will be able to do. But what I wanted to do this year is a real 5K walk run, Now we'll have an alternate route for people that are living with sickle cell disease that might not be able to walk that far, okay? But we're trying to attract people who don't know anything about sickle cell disease, who like to walk for a cause and want to do a 5K. So at we're also having a sickle celebration, and that is in September. September is Sickle Cell Awareness Month, and that's going to be a big party where we're going to celebrate all the successes in sickle cell disease, and that's where we'll have lots of entertainment for the children. We'll have face painting and bounce houses and hot dogs and popcorn. But one of the things I want people to understand that the walk is basically an adult event. It's not playtime. It's like we're here to walk. You get a banana, you get a bottle of water, and when you cross the finish line, you get a medal that says Sickle Cell Matters. That's the theme of the walk. So it's on June 19th. I'm sorry, it's on June 9th, but it's kind of in honor of World Sickle Cell Day, which is June 19th. And I just have to mention here that I was born on June 19th, which is World Sickle Cell Day. So I know that I'm destined to do the work that I'm doing. Yes. And I just want to mention one more thing before your next question. And that is that if you can't come to the walk, one of the things that you can do is go to sicklecellmatters.net, and you can buy a T-shirt. in any color of the rainbow that says Sickle Cell Matters. And then what we want you to do is wear it on June the 19th, World Sickle Cell Day. So all over the state of Michigan, we want people to have on a t-shirt that says Sickle Cell Matters, because I feel like that's really a good way. I mean, if you go to the supermarket, if you're going to work, if you're going to school, you know, if you're down at the waterfront, we just want these Sickle Cell Matter t-shirts to be all over the place. So that would be something that would be really helpful in terms of raising awareness.
So for the walk, that's the day of the walk, right?
The walk is on
9th.
June the 9th.
So go get your t-shirts now.
Yes.
Go to sicklecellmatters.net and get those t-shirts. And you
Right.
just a color of the rainbow.
Right.
And on June 9th, wear them.
Okay, so
everywhere.
now let's get this really straight. Okay, on June 9th is the walk.
Right.
And if you can come to the walk, that is wonderful. Buy your t-shirt and come to the walk.
Right.
All right? But if you can't come to the walk, we want you to still buy a t-shirt and wear it on June 19th,
Wear it on
World
June 19th,
Sickle Cell Day.
World Sickle Cell
And then
Day.
you'll just go on about your day. But in the meantime, you will be raising awareness for sickle cell disease. And you know, people, when they see a pink, they automatically think of breast cancer.
Yes.
When they see red, I think a lot of times maybe they think about HIV and AIDS. And so with sickle cell disease, we don't necessarily have to associate it with the color. So we're just going to have every color in the rainbow, and people are going to be out there just wearing their t-shirts proudly, saying
wearing
that,
purple.
yeah, well, I'm wearing a purple because I'm a part of the sickle cell parent support group. Because
Okay.
in a lot of ways, I feel like I'm a parent to all of my patients. At least I
Right.
try to help the parents. Yeah, so I haven't decided what color I'm going to wear. I'll have to figure that out.
Okay. Okay. But June 19th, where's those t-shirts, people?
Right.
But try to come to the walk as well.
Right.
So what else can we be expecting from the Michigan chapter?
Okay. Well, in November, we are having a wine tasting. It's called Sip and Shoot.
Okay.
And that all this information is at our website at scdAAMI.org. Okay. But another thing that I want to mention is our Cynthia Cole's banquet, and that is on May the 19th. And Cynthia Coles died of complications of sickle cell disease, and she was a member of Friendship Baptist Church.
Okay.
And so every year for over 30 years, and we might be going on our 40th year, they've had a brunch.
Right.
You know, and a fundraiser for sickle cell in memory of Cynthia Coles. So that's also a nice event that you could attend, and it's at the Northwest Activity Center.
Oh, right in the neighborhood.
Yep. Tickets are $35.
All right.
I'll be there, and I give a research update. My dad used to give the research update every year, and now I'm giving it, and sometimes Dr. Sarnak comes in and does the research update for us.
All right. Beautiful, beautiful. So my next question is, do you have any, okay, you just mentioned the upcoming events, obviously. So how do we involve ourselves in the Sickle Cell Disease Association in spreading awareness? What else can the listeners that Mr.BB has and those maybe in different parts of the country do?
Okay. Well, again, wearing the T-shirt is really helpful in terms of raising awareness. Another program that we have is something called High Five for Sickle Cell. And what we like for people to do is do a high five with their friend, you know, and post it on Facebook. And then if you go to our website under High Five, you can learn 5 facts and 5 myths about sickle cell disease, you know, because I just think that one of the things I say a lot is that people don't know much about sickle cell disease, and a lot of what they know is wrong. You know, so we really have been, our first walk was what we called a myth dispelling walk. So we just try to dispel myths like everybody dies by the time they're 21.
Or
you
it's
know,
cancer,
right?
yeah.
Or it's just like cancer, or only black people get sickle cell disease. You know, or everybody with sickle cell disease is very sick and disabled and can't lead a productive life. You know, so we had T-shirts like, "I'm still here, living with sickle cell disease," or "Living well with sickle cell." And another huge problem, Mr.BB, is that we're really trying to address at the adult clinic at Children's Hospital, at University Health Center, is that a lot of times when our patients go to the emergency room, even though the hallmark of sickle cell disease is severe pain,
Yeah.
they get looked at as drug seeking or drug addicts, you know?
Junkies. Yeah.
Right? And that
Yeah.
the only reason they're there is because they want narcotics, you
Right.
know? And so one of the T-shirts that people wore at the walk, at our first myth dispelling walk, was a T-shirt that said, "My pain is real," you know, because we're trying to get people to understand that this is a very painful condition. And we know from studies that people with sickle cell disease wait longer for their pain medication than people with cancer, right? And so another thing that we know is that the longer you wait to get your pain medication, the worse the pain gets.
Absolutely.
You know, so we've got to get ahead of that. And there are a number of ways, the number of bad cycles in sickle cell disease. So we have to kind of break some of these cycles.
Breaking the sickle cycle.
Breaking the sickle cycle.
Okay. All right.
That's our theme.
Yes, absolutely. So let's tell us about the walk again, because I
Okay.
know that's
All
a
right.
big,
Yep.
big
Let's
event
make
we
that
wanna
really
do.
clear. Okay. It's in Palmer Park.
Okay.
And it is on June the 9th.
Palmer Park.
And you can register at our website. And, you know, rather than trying to remember the website, just Google Sickle Cell Michigan. Our website will come up. You know, it'll be one of the choices. Click on it. You can register to walk. Tell all your friends,
Okay.
you know. And then we're going to be out there. The DIA has purchased 6 pieces of artwork that are distributed along Palmer Park. And we met with the people for Palmer Park. And it's really, you know, an up-and-coming area in Detroit. I mean, that people, it's kind of like a well-kept secret.
Okay.
So come and enjoy Palmer Park and do the walk or do the run if you can do it. The first 5 people that cross the finish line in the run get a medal that says champion. And the first 5 that cross during the walk get a medal that says champion. So there's a little bit of a competitive spirit there. And but once again, even more importantly, if you can't make the walk, please go to sicklecellmatters.net. Purchase a T-shirt for $18 in your favorite color. And on June the 19th, World Sickle Cell Day, we want you to wear that T-shirt, and that will really help to raise awareness. And then you can think about wishing me happy birthday, too.
Yes. We'll wish you happy birthday on social media when we get people to take the pictures and post it. Like,
Perfect.
Hashtag happy birthday,
Happy
Dr.
birthday,
Shurney.
Dr. Shurney.
There you go.
That's
All right.
important, really,
Yeah.
right? I will be 61.
Oh, wow.
Yeah.
Happy anniversary. You don't even look it.
Oh, thank you.
You're welcome. Is there anything else you'd like to share with us about the Sickle Cell Disease Association?
You know, I just want to emphasize the importance of, I mean, all of these exciting things are going on with sickle cell disease. A drug company called Global Blood Therapeutics has a medication that's in phase 3 clinical trials that might prove to be really helpful. And there are a number of other drug companies that have upcoming medications. We recently had a new medication called Endari, which is L-glutamine, which is an amino acid that can be helpful in preventing pain episodes, and it's been approved by the FDA, but it's not yet in pharmacies in Michigan, so we're waiting for that. But the thing that I want to emphasize is, what is the quality of life of individuals living with sickle cell disease while we're waiting for all of these good things to happen? And that's one of our real area of focus, is to help improve the quality of lives. And I will say, sadly, that I have been to 3 funerals in the last 2 weeks of patients that I took care of from the time they were born until the time they turned 18, and then stayed in touch with after that, you know? And so something's got to give. You know, we've got to do something, and to have people be aware of what's going on is so important, and that's why it's so helpful if you can get that T-shirt, and June 19th can really be something special.
Okay. Yes, absolutely. We'll get that T-shirt. And also, can we share, I understand, I know I have it, but everyone is free to share that flyer that you sent me for the walk on June 9th.
Absolutely.
Yes.
Absolutely.
Okay, so share that on social media, people that will be
and put on social media to go to sicklecelldiseasematters.net and buy a T-shirt. You know, if you're Greek, if you're in the AKAs, you can buy a pink T-shirt and then wear a green ribbon. If you're a Q, you can wear a purple T-shirt and get a gold ribbon. So the T-shirts can represent, you know, something that's going on in your personal life, or it could just be your favorite color, you know. So.
Okay. All right. All right, Dr. Shurney, well, we thank you for joining us. And
Okay. I
there's anything
appreciate
else
you
you'd like
having
to
me.
share, we appreciate you coming on and giving us some information and some insight on sickle cell, as well as some wonderful events to attend. And we look forward to hearing more from you.
Okay.
All
All right, Mr.BB. Appreciate you.
Thank you. We are back. We are back again. You are live in the D with Mr.BB. And we want to thank Dr. Wanda Shurney for coming in today to discuss sickle cell disease with us and things that the Sickle Cell Disease Association Michigan chapter are doing. So we want to thank her and we will continue to support that organization, and we hope that you will also continue to support. And again, share those links, people. Go to sicklecellmatters.net, get a t-shirt, wear it on June 19th, show those sickle cell colors, because my pain is real. I'm telling you. It is, a little bit. I've living with sickle cell. I've been living with that for years. All right.
Everybody's saying, my pain is real.
My pain is, it's a thing. It is a thing, and it's real.
I'm sorry,
all right.
It is about you.
Next up, we're going to have Kadira, since she wants to talk. Kadira give her daily quotes and some events we can attend to this weekend, as well as we want to say a happy Mother's Day to all the mothers out there, all the mothers, grandmothers, aunties, play mothers, neighborhood mothers. If you're a mother, happy Mother's Day to you, and we play this next song for you. Hi, Mom. All right, we are back, and next up, we're going to have Miss Kadira, who's going to give her daily inspirational positive quote today, as well as an event to attend this weekend. Good morning, Kadira. How are you?
Good morning, Mr.BB.
I'm all right.
You know,
It's Thursday. You need to be positive. The doctor was just in here. She said you need to smile more. Now, Emma,
yes,
more.
I'm glad Dr. Shurney was here. It was very insightful, and we got a lot of information.
Mm-hmm.
That was cool. So, what do you want first, the quotes or the event?
You know what we want. We want the quote. Give it to us.
The invitation to be positive today. Okay, so today's quote is, almost every successful person begins with two beliefs. The future can be better than the present, and I have the power to make it so.
Ooh.
Yeah.
That's deep. Take a moment and let that sink in. All right, that's over. What else you got? What else? What is your event this weekend?
This weekend, and on our Mother's Day, there's a Mother's Day weekend workout at the Underdog Boxing and Performance Gym. It is Saturday, May 12th, from 10 to, what are you doing? From 10 a.m. to 12 p.m. Afternoon. Underdog Boxing and Performance Gym is on Grand River, 4892 Grand River, Detroit, Michigan. For more information, you can look up. Just look up Underdog Gym.
Underdog Gym. So there's
Underdog
Gym. Check out the Mother's Day.
And I just
kickboxing?
Yes. Excuse me. It's kickboxing and yoga. So after kickboxing, you can relax with yoga, stretch out, all that. Namaste. But it's not just for women. Men can go too, because, men have mothers too.
Yes. Y'all came from a woman. Got a game from a woman.
Yes.
It's time that we
be a man.
change for a woman.
Go to yoga with your mama.
Okay. Be a man, go to yoga with your mother. You have to put that on a t-shirt. All right. Well, that is all the time we have today. So, as always, everyone, go out and be great, be educated, be entertained, be informed, and just be wonderful. And join us next week on Live in the D with Mr. BB. Don't forget to check out the Sickle Cell Disease Association of America, SCDAMI.org, and see all the great things they're doing, as well as go to sicklecellmatters.net and get that t-shirt and wear it on June 19th. We hope to see some of your faces at the Sickle Cell Disease 5K Walk in Palmer Park on June 9th.
And wish Dr. Shurney.
And don't forget to wish Dr. Shurney
Sickle Cell Awareness Day.
A happy birthday on June 19th, Sickle Cell Awareness Day. So, we're going to post that flyer. We hope that you all share it, and we will see you all next week. BB out. Bye-bye.